Hi everyone, welcome back. I'm Katie LeBlanc. I'm a patient member of the Arthritis Patient Advisory Board at Arthritis Research Canada. And we're here today at the CRAs talking to some of our amazing researchers to figure out what's new and exciting in the field of rheumatology. So today I have a PhD student, Nicole Tsao, here with us. She's also a practicing pharmacist and doctoral student in the Faculty of Pharmaceutical Sciences at UBC. So, Nicole, can you just tell us a little bit about yourself and your involvement in rheumatology?
Sure, thank you. I'm really excited to be part of this interview and broadcast. So, as you said, I'm currently a PhD student at Faculty of Pharmaceutical Sciences at UBC, and I am a practicing pharmacist. I've worked a little bit with rheumatologists and also dietitians, so a little bit of experience in interdisciplinary care in rheumatology. But most of my research focuses on evaluating the safety of biologic drugs in pregnancy in people with rheumatic diseases.
That sounds really exciting, and I know it's a topic that a lot of us are interested in. So do you want to tell us a little bit more about your research and what you're presenting here specifically this year?
Great, yeah. So this morning I presented on my research evaluating safety of biologics use before and during pregnancy and the risk of often a really scary outcome for people, which is having a baby with malformations. So fortunately, the result was that there was no association with the use of biologics during pregnancy and having babies with malformations. So we're really happy to have seen that in our research. So that was this morning's presentation, and apart from looking at malformations as an outcome, we've been looking at several other outcomes. So the risk of having preterm deliveries, risk of having babies with small for gestational age size, and then also the risk of infections, because biologics is known to be an immunomodulator, which causes infection risk. So those are some of the outcomes I've been looking at in my research, and they're going to be coming out in various media. So we're going to be publishing this, we're going to be presenting it in other conferences and as posters and presentations coming out. And so hopefully, we can get the message out there and have more broadcasts about our work.
Yeah, and that's really exciting and good for us to know who do have a rheumatic disease and are thinking about getting pregnant. We don't have to worry so much about the biologic drugs, at least, that we may be taking, but I'm sure we'll hear more about that soon from your research.
Yeah, that's really the point of what we want to try to do, is to provide, information to patients, hopefully some reassurance about their treatment, so that, people don't think they're scared of taking their treatment, so they go off the treatment if they're thinking of pregnancy. Because sometimes the disease itself can actually give you worse outcomes during pregnancy than the treatment. So depending on what types of treatment you're on or what types of treatment you need, what we just want to do is provide some reassurance and support to patients and some hopefully options that they can look to for their treatment.
Yeah, I think that's a really good point. Having options and having credible information about what we're taking and how that impacts us, especially during pregnancy, is really important. And what we're craving is that information and that reassurance that it's okay, we don't have to be worried, we don't have to go off our meds. And
Yeah, as a pharmacist too, safety of medications is near and dear to me, because throughout my pharmacy part of my life, I have seen patients who, they're young women just like you and me, and they're worried about the treatments and what kind of effects that can have, right? So it's a really scary and kind of vulnerable time for them. So I think to me, it's just I want to be able to help in that way.
And it's often a topic we don't usually discuss a lot in rheumatology, so it's great that patient voice and perspective is probably influencing that research topic. Okay, so what are your thoughts about this year's meeting theme, which is all about personalized and precision medicine going forward in rheumatology?
Well, to me, obviously, because I work a lot with medications, to me, I think, personalized medicine is so important. If we can get the right treatment to the right people, something that is, tailored towards you as a patient, and sort of also incorporating your preferences and your values for medication taking. To me, that's, what we should strive towards altogether. So I think it's such an important theme, and I'm glad to see that we're focusing on that here at this meeting.
Yeah, it's really interesting and really bringing more of the patient perspective into play.
Yeah.
And along with that, as a pharmacist, how are you seeing interdisciplinary interaction between a patient's medical team, such as a rheumatologist and a pharmacist and other practitioners. How do you see that moving forward in the future?
Yeah, I think actually rheumatology is such an interdisciplinary area of medicine. Like, I've been really impressed by the amount of professions that are engaged in rheumatology. So, of course, physiotherapy, occupational therapy is such an important part of rheumatology care. So, I mean, to me, in my experience, it seemed that pharmacy was played a lesser role in rheumatology care, because nursing obviously also very important. So in the future, I hope to see more involvement of pharmacists, because the patients are on a lot of medications a lot of the times, really complex regimens of their medication, and maybe even something as simple as taking methotrexate the right way once a week rather than daily. That's an issue that we often see in pharmacy world, is that mix-up between the regimens. So I think there's a role for all the allied health and all the parts of the interdisciplinary team. So I just hope to see hopefully a more prominent role for pharmacy in the future in rheumatology.
Yeah, for sure, since our pharmaceuticals make up such a huge part of our management toolkit.
Yeah,
it's
exactly.
really important. And finally, what lifestyle tips do you have to offer for young women who are thinking about getting pregnant and do have a rheumatic disease, and will help to make the pregnancy as pain-free and flawless as possible?
Lifestyle tips. Well, I think it's probably pretty important to make sure you discuss the plan with your healthcare provider. So whether that be probably first and foremost your rheumatologist, and maybe even your allied health professional, so maybe your nurse or the pharmacist, is to discuss with them your plan moving forward, starting from even when you're just thinking about pregnancy, because some of the medications might need to be stopped before you actually get pregnant. So it's important to think ahead and discuss with them the plan for what you want to do about your pregnancy. So I mean that would be my advice. Lifestyle tips, I don't know. Keep healthy, of course, right? Keep exercising. Keep just engaged in your health.
Great, thank you. Do we have any questions from the audience?
So these are questions we received via email. How can family and friends support expecting mothers who have arthritis?
Oh, that's a good question. I mean, I've never experienced pregnancy myself, so it's hard for me to say. But of course, I think as a researcher that looks at medications and managing their health with respect to treatment during pregnancy, I think it's important to be there for your family members. Maybe go with them to doctor's appointments when they discuss your treatment regimen. Things can get maybe complicated. You might forget some details. So family and friends are always helpful to be there with you to help remember the details.
And where can patients find more information about classes they can take for such a prenatal classes, but specific for someone living with arthritis?
Ooh, I don't think I know the answer to that. I don't know. Do you know if the Arthritis Society or...
Yeah, the Arthritis Society would probably be a good place to start for a resource.
Yeah.
So look at their website, search under pregnancy, or even give them a call, and I'm sure they would point you in the right direction. Okay, so that's it from the audience. So Nicole, I just wanted to thank you again for taking some time out of this busy CRA this year to chat with us and give us some information that we can all take away.
Great. Thank you so much for having me.
Thanks.